Hi everybody, Dr. Sia here. Welcome back to the Dr. Sia channel and the series that we have here on psychotherapy. Now, in this session, we're going to be working with Hannah, who has a mixed diagnosis of depression and anxiety prior to coming in. This is my first session with her, and she's going to be very suspicious of therapy, very suspicious of me, which is very common for people who have been in therapy for a long time and nothing has helped. Let's see if we can help Hannah get just a little bit closer to accepting that therapy might be useful for her if that's what she wants. So, no spoilers, let's get started. All right, so Nicole's going to be Hannah. Off we go. Yeah? Hannah, what are the problems you've been having?
I have been diagnosed with anxiety and depression for the past 15 years. I've been seeing a lot of people and nothing changes.
A lot of people? What do you mean?
A lot of psychologists,
Uh-huh.
counselors, doctors.
And why does nothing help?
I don't know, because therapy's useless.
Okay. But yet you're in therapy here? What brings you here?
Well, I've been having the same thing for 15 years.
Yeah.
So I want things to change.
Okay. You're saying that therapy is useless. I'm wondering, are you having some thoughts here that I'm going to be useless to you as well?
Well, no one else has helped, so yeah, probably.
Yeah. What are those ideas about? Help me understand them.
Why therapists are useless.
Well, why I'm going to be useless to you?
Because all you want to do is talk.
Mm.
And talking does nothing.
Mm.
There's no benefit. I want to just have things fixed.
You just want to fix the depression and the anxiety within you.
Yeah.
And you don't see talking as being a way that that can be done?
No, I've been talking about it for 15 years and nothing's changed.
What are your ideas about good solutions for it?
Well, I don't have any or else I wouldn't be here.
All right, okay. So I can see that there's something within you that's really has this idea that talking therapy is not going to be good for you, and the problem is probably bigger than that it needs a bigger solution.
Yeah.
Yeah. I'm wondering here, are you then having some thoughts also about me? About what I'm going to be like as a therapist?
I guess you're going to be the same as everyone else.
And what's that?
Useless.
Useless. Can you describe that? What happens? What is it in part of therapy that becomes useless to you? How does it become useless to you?
I just feel like people talk and talk and talk, and there's all of this how does it make you feel stuff, and it's not actually helpful. Right. And then like I leave and I'm like, oh, there's a list of things that I need to think about or do or whatever.
Okay.
It doesn't change anything.
I noticed that what you were talking about there was a lot of what the therapist is doing.
Yeah.
Asking things like, what are your feelings? And then giving you things to do in that.
Yeah.
I wonder, and it sounds to me like that's been pretty useless to you.
Yeah.
I wonder, what are you like in therapy? What have you been like in therapy?
Well, I guess resistant.
How do you mean?
I guess I could work harder.
Yeah. Well, something happens there for you emotionally as you're saying that. What happens there?
I don't know, I guess there's frustration.
What do you get frustrated at?
Well, I guess myself.
Okay. You get sort of frustrated and then that turns back on you and you get angry at yourself?
Yeah.
All right. Does that tend to happen for you in therapy, where you're having conversations with the therapist and then you get frustrated and angry at yourself and then...
Yeah.
What about outside of therapy? Does that tend to happen there too?
Where I get frustrated at myself.
Yeah.
Yeah, I guess so.
And what happens then? Is that sort of when you then think that the therapy is useless to you?
Yeah, probably.
Can you describe that? What happens there? How does that happen?
mean, I feel like I feel like there's only so many times that I can talk about things and then like not get feel like I'm not getting a benefit from it.
Okay, yeah.
And then I guess I question if it's me.
Yeah.
If I'm not doing enough.
Okay. And this idea that therapy will be useless to you as it comes up, when you're sort of being really angry at yourself, what does the angry at yourself look like just before the idea that therapy is going to be useless to you? What does that angry at yourself look like inside you?
Dismissive.
Okay.
I guess.
So you're sort of dismissing yourself?
Yeah.
And then this idea comes, well, therapy is going to be useless anyway.
Yeah.
So as we sit and we talk, and we're talking about things inside you, some part of you dismisses you, and this idea comes along that therapy is just going to be useless anyway.
Yeah.
This idea that comes along that therapy is just going to be useless anyway. Do you think it might be coming up as a way of reducing you dismissing yourself? Sort of, because if you're not here, I'm imagining, well, then there's no reason to dismiss.
I guess so.
Does that make sense? Like, in a way, inside, something is dismissing you, and then you say, all right, well, I'll just dismiss the whole thing. Then I won't have to, yeah.
Yeah. Yeah, that makes sense.
Is that helpful to you? Do you find that that's helpful to you, to dismiss this because some part of you dismisses you?
Yeah, I guess it's the level of self-protection.
How does that protect you? Do you tend to be protected?
I mean, I guess if I'm proven right, then I'm not wrong.
Okay.
Maybe.
All right, so it's in a way, you stand in a position of at least you're going to be right. If this doesn't work out for you, then at least you were right. You knew it all along.
Yes.
And I'm wondering, at the end of that, at the back of all of the times that you've been right about therapy being useless to you, what has that done for you in your life? Do you feel any better? Are you going any better?
No.
What does that tell you?
Maybe I'm not always right.
But what about here with me right now? This idea that you and I are going to be useless here. How's that helpful to you right now?
I don't know. I guess it's not helpful.
You say you guessed it's not helpful. It almost suggests as though you might still have some things that we need to talk about that. It might still be some ideas inside you that this might be useless to you.
Yeah.
Do you think that it's worthwhile for us to keep talking about that over the next coming sessions as well? And see perhaps how you and I can come to an agreement about maybe there are aspects of this that are going to be useless to you, but maybe there are ways to make it more useful to you, or maybe not. But do you think it's a worthwhile conversation to keep having?
Yeah, I'm open to it.
All right, so that was our session with Hannah. Now, there were multiple things there that were happening for Hannah. So, first of all, you might have noticed that she comes in and she's fully projecting. Now, if you don't know what projection is, well, go ahead and watch one of my other videos here. I put the link up there on what projection is. So, what she's doing is she's fully projecting this idea that therapy is going to be useless to her. Now, that part of her that thinks that therapy is going to be useless to her is a part of her that she thinks is very protective. She thinks going into therapy and having the idea that it's going to be useless, it's actually good for me somehow because, hey, it has been useless. Now, what Hannah didn't know is that, firstly, this idea that therapy is useless is a response to something emotional inside. Whenever she starts becoming dismissive of herself, and that gets really intense, she then starts dismissing the whole therapeutic process altogether so that she can reduce the feelings that she's having in that moment. Another thing that does for her, it sort of confirms her narrative, if you will, that therapy is useless and it's not going to work. Like she said, well, if I say that therapy is useless and it turns out to be useless, then at least at the very end I can say I was right. What we want to help her understand and what we try to do is that, well, maybe you would be right, and that's fine. But is that actually good for you? So we're trying to look for the health aspect of it. And we were lucky in that Hannah has the foresight or the ability to see that actually maybe it's that not really good for her. And we didn't shift her along too much. We didn't get her from going, nah, therapy is useless to, yeah, therapy is going to be the best thing in the world. But if we can keep the door open on those conversations about whether she might find it useful, whether she can shift some things inside of herself to make it more useful to her, well, then ultimately she's going to benefit more from therapy than if we don't. I hope you really found this session useful. I hope you found it educational, and I hope you were able to engage with it. Please, if there's anything that you want to comment on, comment down in the comment box down below. Remember to subscribe, like, and press that bell button if you want to get updates for when these sessions come up. It was really good to see you again. Thank you very much. I'll see you next time.